Hello, I'm Shan Park, prosthetic urologist practicing in Seoul, South Korea. Recently, we held Wilson Education Foundation mini fellowship event in my country with my practice. So we invited 3 promising surgeons who are interested in penile implant so that they can have a short fellowship in my practice. Usually, during their fellowship, they tend to get trained by a single surgeon. Then they are on their practice. Once they start their practice, they have no chance to see others how they do the surgery. So which limits their understanding in this field. When I went to the US to get trained with the penile implant, that was not the case. Since I had no so-called formal training, I had to roam around to see the big implanters around the US. So at least I saw 6 or 7 surgeons with the first visit, and it was so great because you can see how different they approach with the difficult cases. In difficult cases, some surgeons apply this one, some surgeons were applying that method, and some were doing this better, some were doing that better. Taking each part from them, I was able to make my own surgery better. Of course, I forgot some of that. So I went back and kept traveling almost now 15 years. I regularly go to the other surgeons' OR to see how they do the surgery. I think heterogeneity is really important for the proper training so that the surgeon can grow into the form that he wishes to. I mean, you can invent it, but if you see somebody doing it, you can do much better. So that was all the concept of this mini fellowship, and Papa Wilson graciously granted young surgeons to come over to my practice to see how we do. We had 3 young fellows: Ahmed Albayrak from the Turkey, Mohammed Hassan from the Iraq, and Hana Guan from the US. 3 of them came from the different, as you can see, countries and different settings. They all had a good experience with the penile implant. So it was a really great joy to have them, since they already know how to do the surgery. In that case, training really can go deeper, and you can really deliver something meaningful. We had one didactic day. Papa Wilson gave them an emergent talk, about 4 or 5 hours of long talk of an intense amount of information about the penile implant surgeries. And then we had 2 OR days in my practice. Then last day we had a big conference with the Korean surgeons so that they can really experience the atmosphere of how things are going in here. So overall, it was a great joy of having them. I thank Dr. Wilson and Barbara Wilson again about this great chance. I am one of the board member of the Wilson Education Foundation. I now suspect that the reason why they had us being the board, I guess now I suspect that Dr. Wilson wanted to train us further to be a good trainer. So being in the board member itself, I believe, is a great chance to learn. So I hope that we could keep continuing the legacy of Dr. Wilson in the field of the prosthetic urology so that many can help the patient further.